Hi, everybody. Welcome. Welcome to another opportunity to meet the authors of our upcoming textbook about lipedema. I'm Leslyn Keith with Lipedema Simplified, and I'm here with my friend and colleague, Dr. Matthew Carmody. Hi, Matt.
Hello. How are you doing, Leslyn?
Good. And I'm so happy to have you here with us to talk about our textbook that's going to be coming out this fall and all the amazing things you've done to contribute to that textbook, as well as the rest of your work. I wanted to tell everybody a little bit about you. For the people who may not know you, Dr. Matthew Carmody is, he's an emeritus professor with Harvard University, as well as with Auburn Hospital. I hope I'm getting this right from memory. He's also done a lot of work with Lipedema Simplified, including collaborating on a paper that we published, I believe, last year, case definitions for lipedema for research. That is, I think, a seminal paper for lipedema, but it also led to our work on this textbook. It's Lipedema, Principles and Practice of Diagnosis and Treatment. And Dr. Carmody, you have contributed 2 chapters for this book. And I wanted to talk a little bit about those chapters. One is the challenges that a primary care physician faces when he has a practice where he's going to be helping women with lipedema. Could you tell people a little bit about that chapter, what they can expect when they get our textbook?
I'm going to go back just a little bit before when I graduated from medical school and started practice in the early 80s. Lipedema was not there. It was never taught in medical school. It was never taught subsequently. And it was reported, though, by people in 1940, but the medical community had never really even decided that it had any credibility. So that description was not adopted by anybody. So what happened is I spent 30 years of practice not knowing that there was a diagnosis called lipedema. And I had a superbly smart patient and somebody that I deeply trusted, who had good control of her obesity, and then in menopause entirely lost her control of obesity, and in fact started developing fat in different areas of her body, mostly her proximal arms and legs and thighs. And in fact, that obesity was actually very painful for her, which was different than the obesity before. So in being in Boston and having so much access to world experts in everything, we vigorously consulted to a lot of hospitals and came back with the diagnosis of that she had obesity and she had lymphedema, and those are the 2 diagnoses that we already knew she had, and that wasn't an explanation.
And just to reiterate, in case people didn't hear it, because you said lymphedema, that the 2 that you knew about were obesity and lymphedema. At this point, you still didn't know about lipedema.
Not at all. So this was one smart patient, and I was a believer in her too. And she's a PhD, and started doing research, and actually found that there was a clinic in Germany that she was going to visit for these kind of disorders. And she walked out of that clinic and she had the diagnosis of lipedema. Mm-hmm. It's a Foldy clinic in Germany. And she came back to me and said, I have lipedema, Lipedema. And I was astonished. I've never heard of that. I Googled it and I looked in literature, and, the Germans and the British knew that term. Uh-huh. And so did people in Netherlands, and starting in Brazil and Italy. And it seemed like nobody in the United States knew about this. But in fact, there were considerably serious researchers in the United States that also knew this diagnosis. But in Boston, it did not exist. And I'm sorry to say that it barely exists now in Boston and needs more. And the problem with this diagnosis is it's 10% of the population that has obesity. And of those with lipedema, the reason that we're all missing it is 60 to 80% of people have obesity and lipedema. So immediately I looked back at my practice and I had 9 other patients that
Yes.
also had this diagnosis.
Yes.
Much to my embarrassment and much to my mistreatment, but they
Dr. Carmody, let me interrupt you just a second, because one of our listeners asks, what year was this that this revelation occurred, that you and your patient figured out that this was what was happening?
So that was fairly recently. It was 2010.
Wow. Yes.
So, and you know, she and I had a relationship of 20 years before that, and then she developed this new thing that occurred, and it is known now that in fact, at menopause, that's one of the times that it can appear or aggressively increase. So I had the privilege of actually taking care of this patient, and then I had the privilege of taking care of other patients that were in my practice, and started to get referrals, you know, from other people to confirm this diagnosis. So I became the source of, at least in my community, you know, of people who know the diagnosis of lipedema, and in fact, it's spreading around Boston as being a known entity. And it's being addressed.
And this is right. It fits right into 2 things that we're talking about right now. One is, this is Lipedema Awareness Month, and so we're trying to get the awareness about lipedema out there. And also, we were talking about the challenges to the primary care provider, and this is the first challenge, is just simply being aware of lipedema and how to differentiate it with obesity and lymphedema.
And I think that the patient had that differentiating effect, like, because she was telling me I am different. So she knew something was up that was different for her. That's number one. And number two, she had pain in her, a lot of discomfort in fatty tissue, especially the new fatty tissue that she developed, and less so in the abdomen and in the chest. That was not a painful tissue, but
and those are areas of typical obesity to be presented in the trunk, and it's not painful there.
Right, exactly. So then I'm treating obesity, but not seeing lipedema. But now I saw lipedema in the last 12 years of my career, and it was like, and then, you know, the patient herself, started to actually, you know, put this together and spread this to the rest of the community, that is the community of patients, and it was, you know, it engendered the fact that we needed to publish what we knew about that, so that the first thing that our group published was how to diagnose this. How do you diagnose this? How do you see it as different? You know, and because I had 9 patients in my practice that also had lipedema, and I had never diagnosed it in them. I had diagnosed them as having obesity, but that was not the right diagnosis. So, then, you know, wonderful researchers, you know, Leslyn, chief among them, you know, and like reading the world literature and trying to understand how do we differentiate lipedema from obesity. They actually came up with a formula, you know, that I worked with them on, but they did all the tremendous research, you know, of the literature, and so we actually put together a definition for this, and we presented that definition in Genoa as well as Potsdam in 2023. You know, just in the latter part of 2023, and it's had a good review, and people that are high experts in the world in lipedema, you know, have really participated in that definition,
Mm-hmm.
and I think that we have something that the providers like myself can use as a tool to make a diagnosis.
Mm-hmm.
And because we got to know so many of the experts, we joined together with them to write a book called Lipedema, of which I have sort of the diagnostic chapter
Yeah.
in the book.
Well, and more than that, in that chapter, you talk about the challenges that someone, especially who's involved in Western medicine,
Yeah.
how do you make sure that the care for a patient with lipedema is comprehensive and compassionate? I think one of the challenges you talk about is that this person has probably been subjected to anti-fat bias. And we do have another chapter on that by Joanna Dudek in Poland. She wrote a chapter just about that because it's so important. But you brought it up again in your chapter because this can make it a challenge when you have a patient who's been subjected to that for most of her life. How does that impact? And just, it's sometimes a challenge being a primary care provider in Westernized medicine.
Right.
So you address those in your chapter wonderfully.
Right. So that's, it's the other thing that about that is that the other chapter that I participate in is the psychological effects on the whole patient with them having a diagnosis, but having no diagnosis, and people not believing, that they are experiencing what they're experiencing, and there is anti-fat bias, for people with obesity that has a terrible consequence on them psychologically. And imagine if you had yet another diagnosis that in fact nearly nobody knows about, and you're carrying that 24 hours a day in this society, this judgmental society.
Yes.
And so the psychological, in addition to the physical consequence of this, the mental weight that you have to carry with this disease is truly, I will tell you that if you want to meet astounding characters who have learned how to survive despite all of us being not as clear thinking as we should be, it is people with lipedema. I mean, they have learned how to be resilient, but they have a lot of bias to bear.
Yes.
It's one of the key interventions is to actually say, no, you've landed. I understand what you have.
Yes.
And I can only imagine how much you've suffered having it.
Yes. And this chapter you're referring to is talking about using a holistic approach. It's typical in Westernized medicine that we only look at the physical symptoms. But what you're talking about is that we actually need to look at the whole person, and we need to look at the emotional, psychological, social, spiritual aspects, as well as the impacts of the physical symptoms on the person. And so this chapter that you co-authored with Siobhan Huggins really makes sure that we're looking at everything that's happening, not just the fact that they have pain, not just the fact that they may have decreased mobility. There's so much else going on that we got to make sure that we address.
Agreed and agreed.
And so this was, I think a huge addition, both of your chapters, a huge addition to our book. And it also led us to say, well, we have this textbook, dense textbook that is from all the experts from around the world contributing to, but we need something that's highly accessible for the practitioner, the healthcare provider that's working with this person. And so we developed the idea of having a handbook. I think the official name is the Lipedema Handbook of Diagnosis and Treatment Guidelines for Clinicians. And Dr. Carmody, you've been instrumental in this because of your chapter. Both of those chapters we're talking about are basically the practical application of all of our knowledge. And so we're going to be having the handbook come out the same time as the textbook.
Right.
And how do you see this handbook being used?
I really think it as you were mentioning, a very practical book, and yet trying to be wise in a very simple way, and making sure that the principles can be understood of treatment, of diagnosis and treatment can be well understood, so that people don't make mistakes and have a clear idea of what is available for them right now, so that what is the system that takes care of this disease of lipedema. Yes, it may take some of the obesity treatment, and we don't know semaglutide or tirzepatide or all those really cool medications that are treating obesity and are the revolution in obesity. We don't know their effect on lipedema at all. Suspect that it might have some, but not a lot. Anyway, that so this is a book that imagines that you are a primary care provider or a provider that's very close to patients and actually can see this and take a stepwise approach, to returning that patient to some less weight and less pain, and actually, also make sure that they're mentally well and treated, well, for the probably the obesity abuse that they've experienced in their lives. My overall feeling of people with this disease is they are people that are resilient and forthright. That they're very lovely people to work with. That's what I found as a physician. Is like anytime that diagnosis was made, I knew I had this. This is a strong person. Learned how to be strong, but also it has those moments when the overwhelming pressure of their disease is hard to bear,
Yes.
and needs support.
Yeah. And so what another way that people can find out about these books and the contribution of all of these incredible authors like Dr. Carmody is that we will be having a virtual event in September. This is about when the actual physical book will be coming out, hopefully both of these two books. And right now, during Lipedema Awareness Month, we have a special price of only $57. So this is a virtual 3-day event. And many of the contributing authors to this text, including Dr. Carmody, will be speaking at this event. It's your opportunity to find out more about the books and to get information from the experts themselves. And the people who are familiar with our events know that this is an interactive event. You are going to have an opportunity not just to hear what Dr. Carmody has to say, but you're going to be able to talk with him. You're going to be able to communicate with him and all the other people that will be speaking at this event. So be sure and look down below to get more information. This is September 26, 27, 28. And during this month, Lipedema Awareness Month, it's an incredibly low price. So check that out, and we hope you join us there. Matt, it's just wonderful always just chatting with you and learning more about your perspective. Anything else you would like to tell our listeners here today about your contributions and what you're trying to share with people?
No, I'm also really interested in people that I think this kind of visiting over a relatively simple way of communicating. At this event, I will probably take patients through a self-diagnosis.
Oh, yes.
Exam.
Yeah. Yes.
So that they can actually get a hold of the fact or not, maybe that in fact they have it. So I'm very keen to tell you how to know it and also how to know that if you have lipedema and obesity. I think we can diagnose both.
Mhm. And perhaps lymphedema as well. The most
Lymphedema as well. Yeah.
things. Yeah, there are ways that you can examine yourself that you might be able to determine this, because it is so hard to find a physician who's knowledgeable enough to be able to do diagnosis. I mean, I think the majority of people have been self-diagnosed or maybe diagnosed by someone that is a healthcare provider that's not a doctor, and so they couldn't officially diagnose, but
Right.
have come together to figure out this is what's going on.
But I think for half an hour, I can make you a good doctor.
Wonderful. This is great. Thank you so much for being here with me today, Dr. Carmody. And I look forward to being with everybody again when we are able to interview other authors that are contributing to our textbook. So until next time, bye-bye, everybody.
Good to be with you.